On January 1, 2025, the average cost of health insurance premiums on the Affordable Care Act marketplaces will soar by 75% in a single stroke, and that very morning, 11 million Americans will wake up uninsured. This is the direct fallout of the Republican Budget Reconciliation Act, signed in March 2025, which slices a staggering $344 billion from Medicaid funding over the next decade. These aren't hypothetical models or academic exercises. They're the hard-nosed findings of the Kaiser Family Foundation and the Congressional Budget Office, both forecasting that 2026 will mark the largest loss of coverage in modern U.S. history. These are firm dates and figures, the outcome of official votes by a congressional majority determined to sacrifice public health at the altar of fiscal austerity and privatization dogma, and they leave no room for doubt or delay. The catastrophe really kicks in when the premium tax credits that made Obamacare affordable vanish into thin air. This was the political weapon Republicans feared most. Over 60 failed repeal votes couldn't stop the law's enactment, yet behind closed doors in December 2017, the Trump administration quietly eliminated the individual mandate penalty with barely a whisper of public debate. No Plan B was prepared, no safety net arranged. Just a pompous Capitol Hill victory lap, complete with self-congratulatory photo ops. Where were all the freedom of choice champions when families faced a 75% rate hike as their sole option? What genuine choice does someone have when a single premium spike catapults them into bankruptcy or forces them to forgo critical care? At exactly the same time, new work requirements for Medicaid snap into place the moment the pandemic emergency waivers expire, branded by the administration as a way to promote self-sufficiency, but in truth calibrated to eject 8.8 million of the most vulnerable from coverage, people who can't document 80 hours of work per month, who hold informal jobs, who care for disabled relatives, or are themselves disabled. This isn't a policy to lift people up. It's a bureaucratic trap that will drive them toward charity clinics, emergency rooms overflowing beyond capacity, and medical debt that already haunts 41% of American households. It's debt that keeps 62% of adults lying awake at night, tormented by the fear that a single ER visit or a chronic condition could devastate their finances and their lives. For a government that brags about its economic success, these numbers should be a source of national shame even among its own ardent supporters. But Trump's playbook isn't about fixing broken systems. It's about dismantling them piece by piece until they collapse, then peddling the mirage of so-called market-based solutions. Indemnity plans with astronomical co-payments, zero-cost share skinny policies that cover almost nothing, state-run micro-insurers operating with minimal oversight. This is the identical logic that empowers private prisons, get paid for every occupied bed, profit more as incarceration rates climb, and lobby to criminalize ever more conduct. In healthcare, the profits flow from your pocket into the coffers of pharmacy benefit managers who processed $334 billion in rebates in 2023 without passing any real savings to patients, and into hospital conglomerates that through wave after wave of mergers hold entire regions hostage with monopoly pricing. Under this system, every diagnosis becomes a billing event, every prescription an opportunity to inflate costs, every hospital bed a high-yield financial asset. It's as twisted as expecting firefighters to bill per blaze extinguished, yet that per-incident profit motive is the beating heart of our healthcare industry. The more services billed, the fatter the corporate profit margins become. The result is a nation gripped by collective anxiety. 2/3 of adults now worry they won't be able to afford emergency treatment, and 36% admit they've delayed or skipped essential care because of cost. How did we allow the idea to vanish that in the wealthiest, most technologically advanced nation on earth we would care for one another in sickness? How did healthcare become a debt sentence? Yet within this manufactured failure lies a narrow but powerful opening for Democrats and anyone who still believes in democracy as more than a slogan. Lyndon Johnson's Great Society of 1965 delivered Medicare and Medicaid as first steps toward universal care, only to see progress strangled by the American Medical Association's smear campaigns and conservative fear-mongering. For decades, the promise of healthcare as a right lay dormant while private insurers, pharmaceutical giants, hospital monopolies, and pharmacy benefit managers stitched together a labyrinthine web of profit-driven incentives. Now that same patchwork is unraveling before our eyes, and the public is waking up to the fact that healthcare can never be a commodity sold to the highest bidder. Nearly 6 in 10 Americans now support Medicare for all, according to Economist YouGov polling. And even in Republican-leaning districts, around 40% of voters backed the proposal when presented as a straightforward single-payer system. This is not a fringe movement, it's a broad groundswell demanding that the basic promise of American democracy, equal access to life-saving care, be honored at last. And there's an equally compelling economic case. Shifting to a single-payer structure could slash administrative costs by hundreds of billions every year. Medicare's overhead runs at just 2%, while private insurers spend up to 13% on administration, marketing, underwriting, and executive bonuses. Studies from the University of Massachusetts and the Annals of Internal Medicine estimate that moving to a public payer model would save between $500 billion and $600 billion annually, savings that could be funneled into community health centers, preventative care, mental health services, and a new civilian care corps to support early childhood programs, elder care, and climate resilience projects. Imagine a just transition initiative that redeploys the 1.8 million displaced insurance industry workers into these vital services, robust retraining programs, guaranteed relocation assistance, bridge salaries until new placements are secured, and pension protections for those near retirement. Picture a civilian care corps offering dignified public employment in under-resourced communities, anchored by partnerships with community colleges, local health departments, and environmental agencies. This is the kind of systemic overhaul that restores the social contract, turning a nation of profit centers into a society of shared responsibility. The moment demands civic engagement and moral clarity. Shine a spotlight on the privatization smokescreens. Call out every hospital foreclosure, every emergency room meltdown, every family bankrupted by medical bills. Health is a public good, not a revenue stream. The price of democracy is steep. When we tolerate systems that abandon the sick, we corrode social mobility, erode trust in institutions, and betray the foundational principle that government's highest duty is to protect life and well-being. While Trump and his allies toast deficit reductions at the expense of human lives, the rest of us must stare into the shattered mirror of a system built to enrich the few at the many's expense. This crisis is no accident. It is the extreme expression of a doctrine that elevates private profit above collective protection. Only by acknowledging that profit and healthcare are fundamentally incompatible can we summon the resolve to build a system that fulfills the great society's unfinished promise. The question now, rhetorical yet urgent, is this: will Democrats and all citizens of conscience find the moral courage and political clarity to pull the country back from the brink, or will we continue to let corporate greed decide who lives and who dies in the richest nation on earth?